Dear students, today we are going to discuss about the sciatic nerve. Sciatic nerve, it is the thickest nerve of the body and it is a terminal branch of the lumbosacral plexus. What is meant by that? See, this network of nerves is known as lumbosacral plexus, and this network gives a nerve. See, now this nerve, this is the sciatic nerve. Means the sciatic nerve arises from this lumbosacral plexus, and the sciatic nerve, it is the thickest nerve of the body. So those first 2 points are clear. It is the thickest nerve of the body and it arises from lumbosacral plexus. Now course. So sorry, details. First root value. It is arising from ventral ramus of L4, L5, S1, S2, S3. Means ventral ramus of fourth lumbar nerve, fifth lumbar nerve, then first sacral nerve, second sacral nerve, and third sacral nerve. Okay, so this is what the root value. Now the details. It consists of two parts, tibial part and common peroneal part. We'll see the details of those tibial part and common peroneal parts later. Now the cause. See, it arises in the pelvic region. The formation of the sciatic nerve takes place in the pelvic region. From the pelvic region, it passes through the greater sciatic notch or the foramen below the piriformis to enter into the gluteal region. What is meant by that? See here in this image, see this is the pelvis. So the formation of the sciatic nerve takes place here inside the pelvis. Okay, now this nerve leaves the pelvis. Okay, see like this, it leaves the pelvis through this notch. See here on this side, this notch. This is the sciatic notch, greater sciatic notch. See the greater sciatic notch in the opposite side. See this is the greater sciatic notch. So the sciatic nerve, formation of the sciatic nerve takes place in the pelvic region. From the pelvis, it leaves the, it enters into the gluteal region through this greater sciatic notch, or it leaves the pelvis through this greater sciatic notch. Okay, now another point is there below the piriformis muscle. What is that? See, this is the piriformis muscle. Now here it is seen below that. So below the piriformis and it reaches a gluteal region. Now this is the gluteal region. So from the pelvis it is entering into the gluteal region through the greater sciatic notch. That's all. See it once again from the pelvis. From the pelvis it is entering into the gluteal region. Gluteal region means backside through this greater sciatic notch. Okay, so these 2 points are clear. Now here in the gluteal region, it lies deep to the gluteus maximus muscle and it lies on the superior gemellus, obturator internus, inferior gemellus, and quadratus femoris muscle. Okay, what is meant by that? See here, this is the sciatic nerve. It lies on these muscles. Okay, so here we are having the superior gemellus, inferior gemellus, then this is the quadratus femoris. Okay, then so superior gemellus, inferior gemellus, obturator internus, and quadratus femoris. So it lies on these muscles. Okay, and this nerve is covered with another muscle, that is the gluteus maximus. So here what we did is we have removed the gluteus maximus. Means gluteus maximus is not there in this diagram. Okay, so it lies on superior gemellus muscle, obturator internus muscle, inferior gemellus muscle, and quadratus femoris muscle. See it once again. See here in the upper part there we are having this superior gemellus, and here in the lower part inferior gemellus, then obturator internus, then here quadratus femoris. Okay, means we can conclude it in this way that it lies on these muscles: superior gemellus superior, gemellus inferior, obturator internus, and quadratus femoris. Okay, so here in the gluteal region it lies on these muscles, and there it lies between ischial tuberosity and greater trochanter. Ischial tuberosity and greater trochanter means the here this is a greater trochanter, and approximately here comes a ischial tuberosity. Okay, so it lies correct now. This nerve lies between the ischial tuberosity and greater trochanter. So pelvic course is clear. Pelvic course and gluteal course. It gives no branches in the gluteal region. Now in the see from the gluteal region, see this image, from the gluteal region it is entering into the thigh. Okay, it lies in the posterior side of the thigh. Now the course in the thigh. In the back of the thigh, it lies deep to the biceps femoris and adductor magnus. It lies deep to the or it lies between the biceps femoris and adductor magnus. We have to check it. See here we can see the cut section of the biceps femoris, and here we can see another muscle. This is a adductor magnus, means it lies between this adductor magnus and this biceps femoris muscle. It runs downward between the adductor magnus muscle and biceps femoris muscle and reaches the popliteal fossa. Now this fossa, this is a popliteal fossa. Okay, so here in the thigh, it runs downward. There it is related to these two muscles, adductor magnus and the biceps femoris muscle, and reaches the popliteal fossa. Towards the popliteal fossa, it divides into two terminal branches. What are the two terminal branches? See, into two terminal branches, tibial and common peroneal nerve. Tibial nerve one. See, this is a tibial nerve, and this one is a common peroneal nerve. Okay, I already told you it is having two parts, tibial part and common peroneal part. See here, it is separating tibial. It is divided, or it is dividing into tibial nerve and common peroneal nerve. Now, what are the branches of the tibial part? When it runs downward, see, already told you it is having, this nerve is having two parts, tibial part and common peroneal part. When this nerve runs downward through the thigh, it gives some muscular branches to the posterior compartment muscles. This tibial nerve, tibial part or tibial fibers gives some muscular branches to this posterior compartment muscles of the thigh. What are the posterior compartment muscles of the thigh? Here we are having the biceps femoris, then semimembranosus, semitendinosus. So tibial part gives, see, tibial part gives some muscular branches to biceps femoris, semitendinosus, semimembranosus, and some ischial part of, or hamstring part of the adductor magnus. So it gives muscular branches to these thigh muscles. Tibial part gives muscular branches to these thigh muscles. Then common peroneal part gives one muscular branch to short head of the biceps. So what is that short head of the biceps? See this one. See, this is the short head of the biceps. It is supplied by the common peroneal part. Okay, in addition to that, it gives articular branches to that hip joint. And after giving these branches, it terminates by dividing into tibial and common peroneal nerves. We already saw. See, after giving these branches, tibial fibers gives some muscular branches to this posterior compartment muscles. Then common peroneal part gives one muscular branch to this short head of the biceps femoris. And after giving all these branches, see here in the popliteal fossa, this nerve is divided into tibial nerve and common peroneal nerve. Now we'll see the details of the tibial nerve. See, tibial nerve in the popliteal fossa, it runs downward from the superior angle to the inferior angle. See, this is the tibial nerve. Okay, see here it runs downward from the superior angle to the inferior angle. Then here on the leg, and after crossing the popliteal fossa, see after the popliteal fossa, it is entering into the leg. See, there in the back of the leg, the nerve descends along with the posterior tibial vessels. Posterior tibial vessels. It lies superficial to the tibialis posterior muscle and deep to the flexor digitorum longus muscle. Two muscles are seen in the posterior compartment of the thigh. This is the posterior compartment of the leg. Okay, tibialis posterior and flexor digitorum longus. So this nerve which lies between these two muscles. Okay, and towards the lower part of the leg, there it passes. There it divides into two. What are the two divisions? One is the medial and lateral plantar nerves. Okay, medial plantar nerve and lateral plantar nerve. So it was a lower part. So it was a lower part of the leg. It divides into medial plantar nerve and lateral plantar nerve. So this is what the course of the tibial branch. Tibial branch in the popliteal fossa, it runs vertically. Then in the posterior compartment of the leg, there it lies between two muscles, tibialis posterior and flexor hallucis, flexor digitorum longus, and it was a lower part. There it passes deep to the flexor retinaculum. See here, retinaculum is there, that one is the flexor retinaculum. So here it passes deep to the flexor retinaculum and it divides into two terminal branches. What are they? Medial and lateral plantar nerves. Okay, so course, origin and course of the tibial nerve is clear. Now, what are the branches? See, it gives some muscular branches in the popliteal fossa. What are the muscular branches in the popliteal fossa? Medial, it gives muscular branch to medial head of the gastrocnemius, then lateral head of the gastrocnemius, plantaris, soleus. Means gastrocnemius, soleus, plantaris muscles. It gives muscular branches to the, when it was the popliteal fossa, it gives muscular branches to gastrocnemius muscle, soleus muscle, plantaris muscle. Okay, these are the superficial muscles of the leg, posterior compartment of the leg. Okay, now there we are having the deep muscles in the posterior compartment of the leg. There we are having some deep muscles also. Okay, that what are the deep muscles? See, flexor digitorum longus, flexor hallucis longus, and the tibialis posterior. Okay, these muscles are supplied by the same nerve. Okay, so when it was in the when it was in the popliteal fossa, when this tibial nerve was in the popliteal fossa, it gives some muscular branches to the superficial muscles. And when it was in the posterior compartment of the leg, it gives muscular branch to these deep muscles. Okay. Then in addition to these muscular branches, it gives some one cutaneous branch. That one is a sural nerve. Okay. In addition to the sural nerve, we are having medial calcaneal branch. Then after giving these branches, it terminates by dividing into medial and lateral plantar nerves. Okay. So here it gives some muscular branches and cutaneous branches. After giving that those cutaneous branches, it divides into medial and lateral plantar nerves, and those nerves supply to the muscles of the foot, plantar aspect of the foot. Okay, so that's all about the tibial nerve. Okay, so tibial nerve first it runs downward through the popliteal fossa, then it runs downward through the posterior compartment of the leg, then towards the medial side of the leg, it divides into two terminal branches. Then muscular branches, when it passes through the popliteal fossa, it gives some muscular branch to the superficial muscles of the posterior compartment of the leg. Then when it was in the posterior part of the leg, it gives deep muscles of the leg. Now, the common peroneal nerve. Okay, see, common peroneal nerve, so it is a small subdivision of the sciatic nerve. It lies in the upper lateral part of the popliteal fossa. First, it lies in the upper lateral part of the popliteal fossa. See, this is the popliteal fossa. Okay, this is the upper lateral part of the popliteal fossa. So here it runs downward along with this biceps femoris muscle. Then after that, it crosses the lateral bone, which is the lateral bone here, fibula. So here it crosses the head of the fibula and reaches the lateral compartment of the leg. Lateral compartment of the leg, there we are having mainly two muscles, peroneus longus and peroneus brevis. Okay, you see. So first it lies in the upper lateral part of the popliteal fossa along the medial border of the biceps femoris. That point is clear. Okay, it runs downward along the medial border of the biceps femoris. Then it turns around the lateral surface of the fibula. Okay, means here it winds from the lateral side of the head of the fibula and enters into the peroneus longus muscle. Okay, inside the peroneus longus, this common peroneal nerve divides into two terminal branches. What are they? One is a superficial peroneal nerve, the other one is a deep peroneal nerve. Superficial peroneal nerve supplies to peroneus longus and peroneus brevis, and a deep peroneal nerve supplies to anterior compartment muscles of the leg. Okay, so posterior compartment of the leg is supplied by tibial nerve. Anterior compartment and the lateral compartment of the leg are supplied by this branches of the common peroneal nerve. Anterior compartment by the deep peroneal nerve and the lateral compartment by the superficial peroneal nerve. Those are the three compartments of the leg: anterior, posterior, and lateral. So that's all about the sciatic nerve. The remaining details you have to read from your textbook.